You may get into a vein and you're there, but it collapsed on you. Maybe that the vacutainer was too strong, so it sucked a little too fast, or the syringe, if you're drawing from a syringe, you may have pulled back too fast. So very important. If you feel like you're in a vein and it collapses, it may just be that you need to release the tourniquet, allow more blood flow, or maybe the wrong type of needle that you used, or it may be the vacutainer or syringe. As far as the tourniquet, it's very important to not have it too tight or too close to the site. That can cause a vein to collapse. Also, when you are using a syringe, very important not to pull back too fast. That can cause a vein to collapse. Anchoring is very important. Again, you don't want to move around, and so you want that needle in the vein and your hand to be very stable. That way there's no risk for movement and losing the vein. So anchoring, very important. Veins can roll, they can move, and so it's very important to anchor down and make sure that that vein is nice and stable. Always be careful of the brachial artery and nerves. Again, this is where proper placement and vein selection is very important. Sometimes the tube vacutainer system can be an issue where maybe it lost its suction, and so that happens. Again, having extra tubes within reach is very important. That way, if you feel you're in the vein or something, the flow stops, you have another tube you can pop on to see if that will increase the pressure and help get the blood flow. Very important, no more than 2 attempts. If you poke a patient and you miss, you have a right to do it again, but if you've missed twice, then you grab a coworker and have somebody else do the draw. And it's important for, if you are redrawing, to not go in the same exact site that was just poked. Here's a diagram here of the correct angle and what can happen if you don't have the correct angle with the needle and how it can hit the wall of the vein, if there's a hematoma. So very, very important, the angle of the needle and the depth of the needle. Nerve injury, typically if it happens, the patient will make it very obvious. It's extremely painful. So they will let you know it hurts a lot. It will, you may nick the nerve and it will send a shooting pain up and down their arm. And so we want to be careful when we are drawing near a nerve to make sure and take the extra time and not go too deep, have the right angle. Also, there can be some legal issues with that. We have to document the incident and follow the facility policy for any follow-up that they may need. There can be a type of anemia that can be caused by treatment. So if we draw too much blood, that can affect the levels, obviously. And so it's very rare to have the iatrogenic anemia, but it can happen. It's especially dangerous for infants and elderly. Very important that we do not remove more than 10% of the patient's blood. It can be life-threatening. So we always collect the minimum amount of blood and avoid redraws, and your facility will train you on the amount that you are allowed to draw at a time, but never more than 10% of the patient's blood. Hemolyzed specimen can happen, hemolysis, which can often be caused by vigorous mixing, a small needle where the blood cells couldn't get through the small needle, and so they rupture, causing hemolysis. If the alcohol is not dry when you do the draw, that can alter and cause hemolysis as well. Probing or pulling the plunger back too fast, this can cause rupture of the blood cells, all due to improper technique. So very important. If the lab runs tests and it shows that this sample has hemolyzed, they will reject it and you're going to have to do another draw. If your centrifuge is too fast or the settings are off, that can cause hemolysis as well. So it's very important to make sure your centrifuge is at the right settings. Also, certain physiological factors can alter and cause hemolysis as well. And so certain anemias, mechanical valves, microorganisms, medications, that can happen. And so that may not be anything we can control, but it may come back rejected due to hemolysis, and then the doctor would advise. The tests that are most commonly affected by hemolysis are listed in this chart here. They're very specific for needing each and every blood cell. Anticoagulant reflux. You can have backflow from a tube to a vein. This is very uncommon now that they have the vacutainer system. You can have adverse patient reactions. Always important to avoid reflux. Make sure you're using the appropriate tools and supplies. Hematoma formation. This is the most common problem that can happen with a blood draw, and it's often from improper technique. So maybe you forgot to release the tourniquet, therefore the blood there was high pressure when you remove the needle, and that can cause bleeding under the skin. Inadequate pressure and bending the arm, probing, faulty needle insertion, too large of a needle, accidental arterial puncture. You can have injury to surrounding tissue that can cause a hematoma. Tube labeling, very, very important. Always double check your labels. Make sure that the labels match the identification band if you're inpatient, and always make sure you ask the patient to spell their first and last name. Have them watch you label the tubes. Make sure the appropriate requisition form is with the appropriate tubes. Labeling is very important. The lab will reject it. Also, we don't want to risk confusing one patient with the other. Bandaging. If there is excessive bleeding, it's important to apply pressure. And so always use pressure if the bleeding is not stopping quickly. Just continue to hold pressure instead of just wrapping them up and having the patient go. There's some syndromes that can be caused by this. And so if there is excess bleeding, always make sure and hold pressure for the appropriate amount of time and double check the wound afterwards to make sure the bleeding has stopped. If you accidentally hit an artery, you'll notice it's bright red blood. The blood will be pulsing, and if that happens, you have to apply direct pressure for 5 to 10 minutes, and you always document that you had this happen. Last slide here, specimen rejection. Very important we don't have this happen. It can happen frequently, and that's where it's important to always label your tubes if they're mislabeled, even if you don't have the date on them or you write the first initial and not the full first name. The lab has the right to reject your specimen. If you have inadequate volume, if you're running a blood test for a coagulation study, it's important to have that tube completely full, because they look at the ratio of the anticoagulant in the tube to the amount of blood that's supposed to be in the tube. If you use the wrong type of tube, they can reject it. Often they can't even run the test that you need. Hemolysis, again, that can happen with different techniques, where if you use a small needle when the patient has thick blood, the blood cells can rupture and cause inaccurate results, as well as if you vigorously shake the tubes, it can cause rupturing. And if you draw from certain areas or don't process the specimen in an appropriate amount of time, it can cause hemolysis. You can have clotting in a tube, and so it's important to watch the amount of time a tube has been sitting. The protocol for a gel barrier tube, which is one you spin to separate serum and plasma, is that it sits in an upright position for 15 to 30 minutes, then you centrifuge. If it sits too long, it will clot to too much and then can alter the test results. If it doesn't sit long enough, it may not clot enough and can cause inaccurate test results. So very important to follow the protocol for coagulation studies. Improper transport conditions. Some tests are required to be refrigerated, some are frozen, some are room temperature. So very important to make sure that we follow those rules and store the specimens properly. Specimens without requisition forms. If you forget to put the paperwork with the blood samples, very, very important that you don't do that because then the lab won't know what to do. And often they just reject the blood, even though they have the blood in the patient's name, they have to have the paperwork attached to it. Contaminated specimen containers, that can happen if the tubes are not sterile, if they've been used before, if it's a urine test and you open the lid and then use that same container, again, for a test that can cause issues with contamination. So very important to make sure that your specimen containers are clean, not reused, and you have the appropriate tubes or cups for what each test is needed for. Delays in processing, that's a big one. Sometimes if you forget to centrifuge, which can happen, the blood can clot too quickly. You forget to refrigerate when it needs to be refrigerated immediately or frozen immediately. That can alter the test results. So very, very important to understand the protocol for each test and store and do the draw correctly and have the correct make sure that you have your, often there will be a handbook or an online system that will tell you exactly how they want the test ran and what to be done. So make sure you always follow the guidelines. And that will do it for this lecture. That's a lot of information. We'll go over this in the laboratory as well, but feel free to let me know if you have any questions. You can email me. This is just covering the basics, and I look forward to seeing you all again. Take care.